Passion Now Network for All, in short CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, presents this week's breaking news in wellness and in health, and it's for all people and all professionals. Hi, I'm the Pete of Dr. Z and Pete, presently the president of Bethel House of Refuge, Muhammad, Illinois. Previous to that, I was the president of a commercial construction company operating in the East Central Illinois area. I and my wife Stephanie live in Farmer City, Illinois. This distinguished fellow on my right is my good friend and co-host, Dr. Alex Raymond Zachariah, MD. Doc is also a medical professor and, as I mentioned, the CEO of CNN4All International. Recently, Doc was the chief medical officer, the medical director of Provena, now Presence United Samaritan's Medical Center in Danville, Illinois. Doc was in that position all of 2008 and part of 2009. And prior to that, he was the dean of one of the top 12 medical schools out of 300 plus medical schools in India, Christian Medical College in Ludhiana, India. Doc, with his wife Prema, also a retired physician and a professor, spent 43 years at Christian Medical College, Ludhiana, first as medical students and then as faculty until they retired from that facet in the year 2000. They now live in Urbana, where they've resided since 2005. Doc, you got a great resume, a lot of experience, and a lot of knowledge. A privilege to have you here with us on Breaking News in Wellness and Health, and I need you to explain to the folks what we're all about here.
Please note, this is not medical advice. This is for your information only. Do not change your treatment based on this info. You may mention this to your physician. You may even ask him to watch this.
Yeah, we'd like for him to watch it. Ask him to watch it. I'm going to ask my doctor to watch. If you need to communicate with us, you can email us, breakingnews@cnn4all.org. Okay, so if you need to do that, questions, comments, suggestions, please do it. Hey, there's something new on the horizon. It's called e-cigarettes, and they're promoted as a way to quit regular cigarettes, and they may actually be a new route to conventional smoking and nicotine addiction for teenagers, according to this study. In the first analysis of the relationship between e-cigarette use and smoking among adolescents in the U.S., researchers found that the adolescents who used the devices were more likely to smoke cigarettes and less likely to quit smoking.
The study was published online March 6, 2014 in JAMA Pediatrics. The study of nearly 40,000 youth around the country also found that e-cigarette use among the middle and high school students doubled.
Oh my goodness.
Between 2011 and 2014 from 3.1 to 6%. Studies suggest that e-cigarettes may contribute to nicotine addiction and are unlikely to discourage conventional cigarette smoking among youth.
The young people. Well,
this is from frying pan into the fire.
Into the fire. And the truth is, what the studies suggest is it's not so much the smoke going in as it's the hand-to-mouth thing, and then the nicotine. And I've seen them. They got nicotine in them. And so that you're taking it in. So you're exactly right, Doc. Couldn't have said it better. Out of the frying pan and into the fire, because you think you're free and you're really not.
No. And you get hooked and you think you are protected.
Oh my goodness, yeah.
You are protected. No.
Yeah, well, who said that nicotine addiction is good for you? And just without the smoke, that doesn't work. Okay, poor oral hygiene and excess sugar consumption can lead to periodontal disease, where the supporting bone around the teeth is destroyed. My. It is thought that chronic infection from gum disease can trigger inflammatory response that leads to heart disease through a process called atherosclerosis or hardening of the arteries. Your gums can cause that problem.
Published in the Journal of the Royal Society of Medicine, December 2013. There is convincing evidence linking poor oral hygiene to premature heart disease, as well as having high levels of fat and salt. Junk foods often contain a great deal of sugar, and effect this has been on oral health may be an important additional mechanism by which junk food elevates risk of cardiovascular disease.
Among the different types of things like junk food, salt, sugar, drinks have particular concerns and are the main source of free sugar for many individuals. Reducing sugar consumption and managing dental problems could help prevent heart problems in early life. Listen, you ever been around a guy whose teeth look like he's strained the Mississippi River through them? You know, they're just falling out. And people, they don't seem to really take care of their teeth, but this guy has breath that had knocked down a wooden man at 20 paces. That is an indication that you've got some inflammatory problems, and why would you think it wouldn't affect the rest of your body?
And the heart, and the atherosclerosis, and the heart attacks, everything.
You know, I know a guy that has no teeth up top, and he's always needs to get soft foods. He can't eat nuts. Fruit, he couldn't eat an apple unless somebody cut it up for him. So he's eating carbs and hot dogs.
That makes
and those,
it worse.
Yes, absolutely. So that's a secondary problem there, right?
Vicious
you
circle.
bet. Well, the uplifting effects of energy drinks are well advertised, like Red Bull and all that. But a new report finds consumption among teenagers may be linked with poor mental health and substance use. That's not good substance either. The researchers found that high school students prone to depression, as well as those who smoke marijuana or drink alcohol, are more likely to consume these energy drinks than their peers. The researchers are calling for limits on teens' access to the drinks and reduction in the amount of the caffeine in each can. More than that, they have to be taught responsible behavior. Treat yourself.
Published in the Journal of Preventive Medicine, March 2014, given the negative effect of excessive caffeine in these energy drinks, consumption as well as the coincident occurrence of use of energy drinks and other negative behaviors in teens, the trend we are seeing are more than cause for concern. In recent years, energy drink sales have skyrocketed, with sales increase forecasted to reach 20 billion in 2013-14 in the United States alone. This is almost epidemic. Energy drinks, they think it is
It
good.
is epidemic. You go into any gas station that has, you know, like a little food store in there, they're always in there. Their coolers are packed with all kinds of different energy drinks, and they're like $3.50 a piece. I mean, I worked with a guy that bought 3 cases of Red Bull a week. 3 cases. And he was knocking them down right and left. And
That's caffeine.
oh, yeah.
That's instead of giving a cup of coffee, that energy drink maybe
Plus sugar, brother.
4 cups of coffee.
And it goes right to your bloodstream. A lot of people get it to drive, maybe even truck drivers, just say legal. As 10,000 baby boomers reach the age 65 every day, the incidence of cancer is increasing, estimated to increase by 67% between 2010 and 2030, bringing attention to the nation's response or lack thereof to cancer care. Cancer is diagnosed at a higher rate, and it accounts for more survivors and results in more deaths than in younger patients. Baby boomers, wake up.
Quality of cancer care, addressing the challenges of an aging population, in an editorial published in JAMA, the Journal of the American Medical Association, in November 2013. We need to address the physical, psychological, financial, emotional tolls on caregivers.
You bet.
By developing more effective ways to prepare and support our baby boomers. We need to.
Yeah, absolutely.
We certainly need to, yes.
Well, that's very, very much an issue. And in 2011, 1 in 3 pregnant women in the U.S. delivered babies by C-section.
Very bad.
While cesarean delivery may be life-saving for the mother, the baby, or both, the rapid increase in cesarean birth rate since 1996 without clear indication raises concerns that this type of delivery may be overused, and even for the convenience of the doctor.
There's no doubt that there's a time and place for a cesarean delivery, but we need to be sure that as part of general obstetric practice, we are not overusing this tool for fear or convenience for both patient and physician, particularly primary cesarean delivery.
Yeah.
Give the women a chance.
Well, and I heard that much like the butterfly coming out of the cocoon, the child going through the birth canal, it is a positive thing because
Very
it
positive.
causes the fluid that's in the lungs more easily to be out. And there's a lot of other differences that we really don't know about that we pretend like we do, right?
We do it, no. We are, what is natural, we are short-circuiting it.
Okay, well, look, 4 years of sustained regular physical activity boosted the likelihood of healthy aging sevenfold compared with consistent inactivity. Couch potato. That's what our findings are showing. Those who had regularly indulged in moderate or vigorous physical activity at least once a week were 3 to 4 times more likely to be healthy agers than those who had remained on the couch inactive, after taking account of other influential factors.
This was published in BMJ, British Medical Journal, November 2013. Those who became physically active also reaped benefits compared with those who did nothing. They were more than 3 times as likely to be healthy agers.
Man, we're going to sound like a broken record, but exercise is really the key to longevity. Recent reports warn about a link between eating red and processed meat and the risk of developing cancer in the gut. These reports have resulted in new nutritional recommendations that advise people to limit their intake of red meat and of processed meat.
Published in the Journal of Meat Science, March 2014, the team of scientists concludes that scientists does not yet have a full understanding of how food that we eat affects our gut and our health. To get a better grip on this complex issue, it is necessary that improved measures of how much meat we eat, the composition of the meat we eat, and how this affects the risk that like cancer that can develop.
Yeah, well, there's a lot of red meat in this society. You know, and I'm taking your advice. I'm limiting the red meat. Guess what? Garlic may be bad for your breath, but it's good for your baby, according to this new study that we have. This study is the first to identify 2 compounds derived from garlic, dialy-1 sulfide and agone, that significantly reduce the contamination risk of Chronobacter sakazaki in the production of dry infant formula powder.
You said those words wonderfully. The study recently published in Applied and Environmental Microbiology 2013 is the first to identify 2 compounds derived from garlic. And
what I said, right?
That significantly reduce the contamination risk of Chronobacter sakazaki in the production of dry infant formula.
I hope that helped you out there.
Yes.
There's garlic, what they're saying is very good for you and good for baby. Controlling blood pressure, serum cholesterol, and blood glucose may substantially reduce the risk of heart disease and stroke that's associated with being overweight or obese. Don't use that as an excuse. Research consortium was led by a team from Harvard School of Public Health, Imperial College London, and the University of Sydney in Australia.
This was published in November 2013 in The Lancet. Among the 3 factors, high blood pressure was found to pose the highest risk for heart disease and an even bigger risk for stroke among the overweight or obese participants. High blood pressure poses the biggest risk of the 3 metabolic factors examined. It accounted for 31% of the increased risk of heart disease and 65% of increased risk of stroke among the overweight or obese individuals.
Man, but you still can't, diet,
Yes.
exercise, those things help reduce all of those factors. All work and no play for children, losing their childhood and their happiness. A UK Department for Health Commission survey in 2004 concluded that 1 in 10 British children aged 5 to 16 are diagnosed with mental disorders. Childhood stress, psychological problems, and self-abuse are increasing. Gone are the hazy, lazy days of summer when kids could run free all day and play.
Published in the International Journal of Play, March 2014, through play, children develop an emergent sense of competence, feelings of belonging, usefulness, and subsequent well-being. When deprived of play, children lack social connectivity and have less mental wellness.
Well, Doc, I think part of that is technological.
Yeah,
I think what they're talking about
Yes.
is play that involves going out, running around,
That's
getting
right.
on teeter-totters, swings, hide and seek. We did that as kids, man. We
That's
were
it. Right.
television, all that stuff is depriving them of the
Absolutely.
social skills, which leads to depression. We're actually pack animals, so to speak.
Yes.
You know, we need that gregarious interaction of our fellows.
Absolutely.
And this type of thing, man, get your kids off the TV, get them off. My grandkids come over, they go, hey, Grandpa, where's your phone? I shut it off. Where's your little iPad? I turned it off too. If you just came over here to use my iPad and my phone, that's not going to work. Let's go out and throw the football around.
Wow.
You know, so those things, parents, get on top of that. Don't let them become couch potatoes. It's going to affect their longevity. Well, it's time, Doc.
For Ross?
Yes, it's time. I think Ross is in the green room. We're going to have a panel discussion with him. And we want to thank you for being with us. And we'll see you next time.
Every day, thousands of people are diagnosed with macular degeneration, a disabling eye disease that leads to severe vision loss. As a scientist conducting research for the American Health Assistance Foundation, I want you to know that there is hope that a cure and new treatments for macular degeneration will soon be found, but only if we can continue our groundbreaking research. Learn about my research. Call 1-800-437-2423 or visit ahaf.org.
Compassion Now Network for All, in short, CNN4, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, presents this week's breaking news in wellness and in health for all people and for all professionals. I am the Pete of Dr. Z and Pete. This is my distinguished host on the far right, Dr. Alex Rama Zechariah. Doc's a medical professor and the CEO of CNN4All International. And today we have with us our distinguished expert, Dr. Ross Yoha, joining us, and we'd like to welcome you, Dr. Ross, and invite you to join our panel discussion. Today's panel discussion is regarding two papers presented this month, February 2014, on obesity in developing countries like India and the Samoa, the islands down there, which involves American Samoa and independent Samoa, as well as the archipelago in the Pacific Ocean. What do you think, Dr. Ross? It's good to have you here. I think you have some line of expertise in these areas, don't you?
Yeah, and you know, I want him to start off. Okay, cars, computers, and TV spark obesity in developing countries like India.
Yeah.
And the spread of obesity and the type 2 diabetes, that is adult diabetes, could become epidemic in low-income countries. In India itself, it has gone through the roof. As more individuals are able to own higher priced items such as TVs, computers, and cars. You know, the findings, or these findings of an international study was published in the Canadian Medical Association Journal this month, February 2014. The international research team analyzed data on more than 150,000 individuals, adults, from 17 countries, ranging from high middle income to low income nations. Then the study found a 40%. Can you imagine?
400%.
Oh, sorry. You're right. 400% increase, not 40%. 400% increase in obesity and a 250% increase in diabetes among owners of all these three items.
You know, they said in Samoa that 75% in independent Samoa, 75% of the people were obese.
Obese.
75%.
Yes.
And they attributed that, do you know what? Western diet.
Western diet.
Less exercise. I mean, these people were people that were, you know, their diet was fish and fresh fruit and vegetables, and then you get the westernized, processed, fast food stuff, and they just begin to bloat like we have over in our country.
Those owning all three devices were associated with a 31% decrease in physical activity, 21% increase in sitting, and a 9 centimeter, 5 inches increase in waist size compared with those who owned no devices. Okay, what can heal obesity?
Obesity? Heal it? Is obesity a disease? Come on, Dr. Ross.
Yes, American Medical Association declared obesity as a disease in 2013. What can heal obesity?
Nothing but a change of lifestyle.
God, nothing but a change in lifestyle. How can we shed more fat? Yes.
Nothing but more exercise.
Got it. Nothing but more exercise. Oh, precious is whole food, nor veggies, fruit, whole grains. Oh, precious is nor nuts, nor of nuts go nuts on nuts. Can you go on nuts on nuts?
Oh, I can go nuts on nuts. I did the other day, ate a whole bag of cashews.
What can heal obesity?
Nothing but eating whole food.
God, nothing but eating whole food. Oh, despise fried food starch, less of carb and no sugar. Oh, despise all soda thoughts. Say no to all soda thoughts. Can you?
Yeah, no to soda pop.
How can we shed more of fat?
Nothing but more of exercise.
Got it. Nothing but more of exercise. Oh, precious exercise. 5 days a week or more. Half hour or more daily. Till we are what?
Soaked in sweat.
Got it. Till we are all soaked in sweat. Oh, precious exercise. Walk, jog, run, treadmill, elliptical. Half hour or more daily. Till we are all soaked in sweat. Okay.
Yeah, well, we were talking about American Samoa and independent Samoa. So let's continue on that because that really is critical in our discussion.
The population of the Samoan archipelago in the Pacific developed one of the world's highest rates of obesity. Thanks for the Americans coming there.
Oh, my God. It's just like what happened when we came in the 1600s. You know, you bring the European practices, European food, European way of life, and European diseases. So it's just repeating itself because they are not equipped physically to handle that type of a diet.
About 3/4 of the U.S. territory, 55,000 plus adults population, is obese. 3 out of 4. The highest rate in the world. The independent Samoa of 200,000 population is quickly catching up. Rates of type 2 diabetes top one of the 5, and recent study found that the obesity rates are present even in newborns.
So you have chunky babies. My goodness.
You know, the paper was presented at the annual meeting of the American Association for the Advancement of Science in Chicago, February 16th, just a few days ago, 2014.
Oh, my.
Where Samoans once engaged in sustenance fishing, a lot of exercise, as you said, Teeth westernization has brought fast food, labor saving device, and other conveniences.
You bet. Well, you see that American Samoa has the higher obesity rate than independent Samoa, which means that they've become, quote unquote, Americanized. And Doc, you can go into any grocery store and you can see stuff that's actually, if it's ingested, it's killing you by the minute. And people don't even take, they don't take care. They're not, I see things, I've been in stores, I see people pick up stuff and you think, are you serious? Sugar laden, fructose, corn syrup laden, chemical laden, not even looking at the ingredients.
You know what happened after American westernization came in 1961? Every year, you know, I mean in the 10 years, per day, the calorie person increased by 1,000 calories.
Oh my goodness.
Okay, what can heal obesity?
Nothing but a change in lifestyle.
How can we shed more of fat? Nothing but more
Of exercise. Oh yeah.
Oh, precious is whole food, nor veggies, fruits, whole grains.
Oh, precious is more nuts. More of nuts go nuts on nuts.
Okay, what can heal obesity?
Nothing but eating whole food.
Oh, despise fried food starch, less of carb and no sugar.
Oh, despise all soda pops. Say no to all soda pops.
How can we shed more of fat?
Ooh, nothing but more of exercise.
Oh, precious exercise, 5 days a week or more. Half hour or more daily till we are all
Soaked in sweat.
soaked in sweat. Oh, precious exercise, walk, jog, run, treadmill, elliptical. Half hour or more daily till we are all soaked in sweat.
Boy, that soaked in sweat. The exercise is critical. Diet correction is absolutely critical. This summarizes the obesity epidemic in third world countries and in Samoa as well as the developing world. The American diet is not what they want to partake of. Dr. Ross, we want to thank you for being with us. As always, we appreciate your insight and your advice. Also, it's not advice because we're not giving advice.
Yeah, such
it's
a
just
pleasure.
information. And Dr. Zachariah, we thank you for being with us. We would also like to thank the people from WebMD for the information that we have. Also, the City of Urbana's UPTV production coordinator, Jason Liggett, the one, the only. Our production intern, Caleb Serpenis, and the UPTV station manager, Jake Schumacher, as well as our 3-camera whiz kid, Jacob Bernard, as well. We'd also like to extend our thanks to the Chorister Fellowship in Tiruvalla, Kerala, India, for the music score and the Hallelujah ending. We would like to thank you all for watching us, and we'd like to invite you to be back with us again next time. Same station, same time. Thank you, and God bless you.